How to care for newborn cats. Participate in the study and explanation of this topic drive. Pippa Elliott holds a Bachelor of Science in Veterinary Medicine and a member of the Royal College of Veterinary Surgeons, with more than 30 years of experience in pet treatment. She graduated from the University of Glasgow in 1987 with a degree in veterinary medicine and surgery, then worked as a veterinary surgeon for 7 years before joining a veterinary clinic in her hometown, and has been working there for more than 20 years now. Caring for newborn cats is a difficult business. They need attention and care all the time. If you are in charge of recently born cats, you will need to do more to care. If the kitten is still in the picture, it will meet the needs of the kittens themselves. You can help her by feeding her and leaving the youngsters alone during the first week. If the mother is not around, or if she is unable to take care of them, you will have to perform her duties. This includes feeding the young, keeping them warm, and helping them relieve their needs. Part 1. Feeding. 1. Look at it. The attention that you will give to kittens depends on several things: their age, the presence or absence of the mother cat, and the health of the young. If you find young children separate from the mother, then you will need to provide them with what their mother might do, such as food, warmth, and help with the need. Take the time to look into it before you start paying attention to them. If you find kittens that are born and think their mother has abandoned them or separated from them, watch them from 10 meters away, for example, to find out whether or not the mother will return. If the young are in immediate danger, you will have to intervene without waiting for the mother to return. For example, if they are at risk of freezing from the cold, or are left in a place that could run them over, or in an area with dogs that might harm them, you should intervene immediately. 2. Seek help from your veterinarian or animal shelter. Don't feel like you have to take care of these kids alone. Caring for them can be difficult, and you may not have the ingredients to ensure their survival. Contact a vet or shelter for help. They may be able to provide a surrogate mother to help the little ones get the right nutrition or maybe supply you with a bottle of food. 3. Place the food for the mother cat if she is around. If the mother is present and cares for the young, it will be better to let the mother take care of them. But you can still help by putting food and providing shelter for the mother. Just make sure to put food and shelter in 2 different places, or the mother won't accept them. 4. Feed the young. If the mother is not around or is unable to care for the young, you will need to prepare their own food and feed them on your own. The type of food you will provide them will depend on their age. Be sure to consult your veterinarian about any special food they may need. When the babies are a week or 2 old, feed them every 2 hours with a bottle of commercial formula for the breast milk. Do not give them beef because it is difficult for them to digest. When they are 3 to 4 weeks old, put the milk in a deep dish next to some cat food diluted with water. Provide this food 4 to 6 times a day. When they are 6 to 12 weeks old, increase the amount of milk and start giving them cat food, 4 times a day. 5. Weigh your cats once a week. To ensure that cats get the right food and gain weight, you will need to weigh them once a week and record their weight. Cats should earn from 2 ounces to 1/4 to 3.5 ounces per week. Talk to your vet if your cat doesn't gain weight fast enough. Part 2. Dealing and protection. 1. Leave the children alone during the first week if the mother is present. If the young are heavily pregnant, the mother rejects them, so it is best for them to leave them alone if the mother cat is next door. However, during the age of 2 to 7 weeks, it is important for them to get used to getting pregnant from humans. 2. Gently carry the small children. Be careful when holding your baby cat. If you have children, teach them how to treat gently and only carry cats under your supervision. Baby cats are very fragile and even a small child may cause serious damage. 3. Set aside a place for young children to sleep. If the little ones have no place to sleep, be sure to provide them with a place, provided they are warm, dry, and out of potential hazards. Ensure that the location you chose is away from the air currents. You can use the cat's carry box and surround it with clean towels or blankets. 4. Warm the cats. If the mother is around, you will need to have a thermal pad or hot water bottle wrapped in a towel in order to keep them warm. Just make sure that cats can get away from that heat when they get too warm. Check them every time to make sure they are comfortable. Part 3. Defecating. 1. Let the mother cat help the little ones around. If she is next to them and wants them to help them fulfill their need, let her do her job. During the first weeks of a child's life, the mother will lick their sensitive areas to urinate them to urinate and defecate. Do not interfere when you find the mother doing this. 2. Help the cats to relieve their needs when necessary. If the mother is not around, she will need to help the youngsters get their need through their first weeks. Use a damp cloth or old piece of clothing and gently massage their sensitive areas separately to help them meet their need. Wash the fabric immediately and dry the cats before returning them to their place. 3. Encourage them to use a litter box from the age of 4 weeks. At the age of 4 weeks, kittens will be ready to start using the litter box. To motivate them to use it, put each cat in the box after they're done eating. When she's finished using the box, put her back next to her companions and repeat the process with another cat. Let each cat use the box for 2 minutes after each meal. 4. Watch out for problems. If you notice that any of them does not urinate or defecate when receiving help or when placed in a litter box, you should contact a veterinarian at once and find out what is happening. You may have constipation or have a blockage that needs to be relieved. Useful ideas: don't be afraid to seek help from a veterinarian or animal shelter in your area. They may have available volunteers who can help you take care of cats and increase their chances of survival. Do not let your children under 8 years carry kittens without guidance, until the kittens are 5 to 6 weeks old. Warnings: do not carry a suckling cat like a human baby while feeding it from a bottle. This will make the milk reach its lungs. Place the cat on its 4 feet on the floor or on your lap while it is eating. Cats do not feed cow milk. It is difficult for them to digest it, which leads to their fatigue. Do not bathe the cats before the age of 9 weeks, otherwise their mother will abandon them because they lose the smell they recognize. If you find an infant sick, contact your vet immediately. Symptoms such as cold, laziness, not eating, etc. Cats may die if they fall ill or suffer from malnutrition. If you are about to get rid of a kitten, make sure its box has breathable holes, plenty of covers, and enough food to keep it alive. Cats need warmth, especially if they are outside in cold weather. Comment, subscribe and activate the bell to receive all new and information about your favorite animal.